Good afternoon. I'd like to call the Finance Ways and Means Appropriation Committee to order. We have a couple members that are running late. We're going to get started on time though, but in the meantime, Madam Clerk, will you please call the roll?
Representatives Campbell,
Here.
Faison, Garrett,
Here.
Hazelwood, Hicks of Hawkins, Lamar, Miller, Sexton of Granger, Shaw, Sparks, Zachary. Chairman Williams, you have a quorum.
Thank you. Thank you, members. Today we have a report. We've asked Commissioner Ely to come today, and we have Tony Nickjad with us today from the Financial Stimulus Accountability Group. They're going to share with us their latest report as it relates to the financial group. They have been making these presentations on a monthly basis. As you members may know, members of that committee include Speaker Pro Tem Marsh, as well as I think Harold Love, Representative Love, as well as the Speaker of the House. And so because of the influx of large amounts of money because of COVID-19, and because this is Appropriations Committee, I felt like it was necessary for them to come today and share a little bit about what we've been doing in regards to COVID-19 since March of last year. With that, we're going to go out of session. Commissioner, if you and Mr. Nickjad would introduce yourselves, and then feel free to get started. We're out of session.
Very good. Good afternoon. Thank you, Mr. Chairman, members of the committee. Thank you for allowing us to come today and present to you activities of the Financial Stimulus Accountability Group over the last year. It's hard to believe that it has been a year, but I know that many of you have, it's been a challenging year for all of us as well as your constituents, and we certainly have endeavored to try to make sure that the actions of this group have been a benefit to the state. Our presentation today really will encompass the spending, focusing in on the $2.3 billion that made up the Coronavirus Relief Fund. You'll hear us talk about it as CRF. That was mainly federal dollars that went into stimulus type of activities over the last year, as well as highlighting some of the other funding sources that have been made available to the state. I will say that for the purposes of this presentation today, Tony and I will be kind of sticking to the numbers that this is. We will not be reporting on the health response as it related to COVID. Those are activities that would better be, I guess, addressed to both health and military and TEMA as part of Unified Command. But I think we'll be able to answer a lot of the questions about how these dollars have been expended. As you know, the governor formed the Financial Stimulus Accountability Group, FSAG, as it's referred to, last April, just a matter of weeks after we got our first case of COVID. And the group, as Chairman has already indicated, the group is made up of Representative Love and Speaker Marsh, but the other members, just for your information, it's chaired jointly by Lieutenant Governor McNally, Speaker Sexton, myself, and then also the other members include Comptroller Mumpower, also Chairman Watson, Senator Ackberry, and also Secretary Hargett, as well as Treasurer Lillard, have also become steady participants as we have met over the last year. We meet generally every month. It hasn't been on a certain date every month, and so that's spread over every 30, 45 days generally. And they've been open to the media and open to the public. And I believe all of them have been virtual, haven't they, since we started? Yeah. And We've also been providing periodic updates, some of which you may have received already. And we'll talk a little bit later about the dashboard that we created back in the summer to give you more information. That's available on the F&A website, and my office is happy to provide it if you haven't gotten it. Next, we have largely utilized federal dollars, federal funds for all of our expenditures related to COVID-19. As you're aware, these funds came with many guidelines and restrictions. I don't know how many different iterations of guidelines that we've been through, but many iterations as we have gone through this process over the last year. We know that we've got to get it right, because we will ultimately be audited by the federal government at some point. We know that, and we get this right. We work with every state entity that has been receiving these funds to make sure that we review the spending and determine that it meets the compliances that the federal government has put on this. One example, just for your information, the legislature drew down $332,000 in federal funds for these plexiglass units here in the committee rooms, and that's one of the examples. If you've been to a driver's license center or other state offices, you may have seen similar types of this kind of thing, and that's just one of the expenditures that has come down as a part of this. We have focused on federal dollars, not knowing whether or not we were going to have enough dollars to do the things that needed to be done. We did include $75 million in the fiscal year 20 budget, and an additional 75 in the fiscal year 21 budget. And so we will continue to spend all the federal dollars first. We've got additional dollars in this year's budget, and at first glance, that may seem like a lot of state funds that we're putting toward this, but when you consider the fact that we've received in one way, shape, or form over $15 billion during the last year, then the amount of money that we set aside in case we need it to be able to respond and act quickly, we think is good business. When we look at kind of a high-level summary of the packages, and Tony will get into more detail of what we have seen happening so far. You know that we've had 2 already pass major CARES packages, and I'm sure that you debate in Washington about the package that is being considered now, that is going back and forth between the House and the Senate. We definitely believe there will be a third package that'll come about in the coming weeks. This just kind of shows you the variety of funds that have come in. We in addition to the $2.3 billion related to CRF, we've processed $8.4 billion so far in total federal spending through about 70 individual grants coming into Tennessee. Each of these kind of have their own set of rules and guidelines that have to be carefully followed to ensure compliance. This is kind of a timeline, and there's a lot of words on here, more than I like putting on a typical presentation. But I wanted you to be able to have this presentation kind of as a takeaway to be able to have beyond things that has been paramount in the governor's mind is that all of this be transparent. And we have full accountability and knowledge of where all the dollars have gone and where they've come from. This is the dashboard that I mentioned earlier, and this dashboard tracks every single dollar that has come in and where it has gone, what county it has gone to, and this is available 24/7. If you go to the website, we can let you know where this is, but it's on the F&A website. And what this covers is every dollar of CRF, the 2.3 that we're talking about today. In additional, this covers anything that is passed through, and a good example of that would be unemployment insurance or that type of dollar that's coming in from the federal government and going right back out to an individual, such as unemployment benefit, as well as any funding that's going directly from going directly to those entities. And so when I talk about the $15 billion that Tennesseans have seen as a result of that, that's where that's coming from. So last year, the legislature, as you know, provided F&A some kind of unique permission to expand budgets necessary to implement the CARES Act funding. And obviously that was because of the unprecedented levels that we were seeing coming in from the Fed. But we believe we can now return back to the normal expansion process, and we've already begun to do so. And so you're already beginning to see that, and we'll continue to see that as we move forward this year. But the FSAG's mission as advising on these funds will not change. We'll still be providing critical oversight for the governor on the rest of these funds. And I'm certainly grateful for the efforts of Madam Chair Hazelwood and Chairman Watson in their support as how we've gone about this and the relationship that exists between F&A and your committee. The way I know I appeared before this committee last year and promised and said that we would spend every dollar that came to us. So of the 2.3, at this point, we've allocated around 2 billion of that. One of the things that we thought that we faced a year ago is that we had to spend every one of those dollars by the end of 2020. About 3 days left in December, as you know, the federal government passed the other CARES bill, which allowed us really till the end of this year now to spend all those funds. Of course, we'd already allocated almost all of them by that point. We've got around 300 million or so additional dollars that will be allocated from that. But as I said, we do know that of this bill that's being debated now, there will be additional dollars coming into the state. So the same thing was said last year. We will not be sending any of the federal dollars back to them. We'll make sure that they find a good place. And so since that time, we've been identifying where these dollars could be spent, reviewing how that could be done, and developing a plan to do that, and distributing these dollars as quickly as possible. Finally, these are kind of the actions of our FSAG group. In order to get these dollars out the door, we developed 12 programs to serve Tennesseans, all of which were informed by the FSAG group and that we were seeking to aid. And so I'm gonna turn it over to Tony now to start getting into a little more detail about where the dollars went, and then after that, we'll be able to answer any questions that you may have. Tony?
Yes. So as Commissioner Ely mentioned, there were 70+ grants authorized under the Family First Coronavirus Response Act and its companion, the CARES Act, passed in March and April. At this time, our reporting and the subject of this presentation will focus primarily on those two acts, as the December package authorized by Congress is still in various states of federal review, and the current package is, as the committee is aware, is currently under consideration by Congress. So these charts focus exclusively on those funds that were authorized under the March and April acts of Congress. You'll see that the very top, the non-state federal unemployment insurance benefits exceeded $4 billion as authorized under those acts. The Coronavirus Relief Fund, which Commissioner Ely mentioned earlier, approximated $2.3 billion. And then recognizing the impact of the temporary increase in FMAP under the Family First Coronavirus Response Act, we recognized an increase in revenues to the state of $358 million. You're also aware of the ESSER fund, which went directly to public schools in the state of Tennessee, the Higher Education Emergency Relief Fund, and as well as the Higher Education Emergency Relief Fund. And then another grant that we are also tracking is the ELC fund for epidemiology and lab capacity, which supported testing and lab costs. Thank you. We're also tracking on the dashboard, as part of that $15 billion number, FFCRA and CARES Act funds that went directly to Tennesseans or other non-state entities. That's not necessarily funds that pass through the state of Tennessee, but funds that an individual Tennessean or an individual entity outside the state of Tennessee would have received. We're able to track that because, by and large, the federal government provides accurate and reliable data on that. However, as that data becomes more and more voluminous, it becomes a little bit more challenging to track that accurately, and our updates become a little less frequent. But to date, we haven't experienced universal difficulty in tracking that, and feel very good about these numbers that the federal government is giving to us. Those numbers include the Paycheck Protection Act, to which there's been a lot of coverage and discussion of over $9 billion that have gone through to Tennessee businesses. The HHS Healthcare Provider Relief Fund, which went to all CMS registered healthcare providers in the state. The largest payments going, of course, to our hospitals in proportion to the volume of work that they do. That's approximately $1.3 billion that we're tracking. U.S. Treasury, as part of the Coronavirus Relief Fund, also provided direct distributions to large counties and cities with populations over 500,000. That went to Shelby County, City of Memphis, and Davidson Metro Nashville. In total, that amounted to $284 million. There were also Department of Transportation transit infrastructure grants that went directly to local entities outside of the state. Those exceeded $164 million. And then DOT airport grants, which went directly to airports, both our general service and our commercial service airports. Again, this does not account for funds authorized under the Omnibus Act in December, as well as the funds under discussion today in Congress. The biggest focus and the biggest volume of work of the FSAG group has been on the Coronavirus Relief Fund. This was the largest single grant award after pandemic unemployment assistance that the state was responsible for administering, and provided us the most flexibility to backfill or identify or address gaps in other federal resources and funds. That grant was a very rewarding experience for the state. It was authorized in March under the CARES Act. Guidance was issued in April, and we were under a short-term use it or lose it restriction, in which that December 30th, 2020, these funds were going to expire and revert back to the federal government. So across the country, governor's offices, departments of budget officers, and many city and county officials were working very, very quickly to get these funds administered appropriately and in line with federal guidance that was updated often. In fact, the limitations on these funds, the main limitation is that these funds may only be used for expenses that are necessarily incurred to mitigate or respond to COVID-19. As you can expect, that's, on first glance, it's a very broad limitation subject to interpretation. U.S. Treasury provided ongoing guidance on what that be. The guidance was updated, also helped inform Congress's changes or decision ultimately to extend that deadline a year in light of some vocalized frustration amongst other states and other recipients of those funds. Despite these limitations applied to these funds, it was our objective the entire time to use these funds to their best and highest use to support the recovery of Tennesseans. And I'll walk through those details in these next few slides here.
Let me just add one quick point there. The last point we have on this slide, and that is to rest assured from what I mentioned earlier about expending these funds, we already have enough those standards that Tony just mentioned to where those then of themselves would continue to pay out the remainder of those funds that are there. So we're in no jeopardy of not being able to expend those funds. The question that we have is, since we have those, they extended that time period, can we use these funds in a more judicious fashion to help continue to do some type of stimulus for Tennesseans? And that's the objective. And so that's the way we'll continue to go down. But just making sure everybody's aware that by no means are we in necessary of losing those funds. It does though kind of demonstrate the fact that having those funds available were important to us on the front end, those state funds, to where we could have leaned back on that if necessary. And that's the reason we continue, and we'll be able to figure out what to do with them. So go ahead, Tom.
Thank you, Commissioner.
Yeah.
And yeah, I think the prioritization and really the approach for those funds was to deliver aid to as many Tennesseans before delivering aid to the state. I think we, in parallel with the administration of these funds, went through an appropriate process in right-sizing our expenses and budget in a way that kept us on fiscally stable grounds, which reduced our reliance on these federal funds and allowed us to invest more of them in supporting Tennesseans directly, which is what this chart intends to show. As a matter of our priorities, over 50%, nearly 3/4 of the funds expended to date have been towards economic, community, and individual relief. Half of that being support for the Unemployment Trust Fund to help avoid tax increases on Tennessee employers. Our next slide will show that program, but this slide just gives you an overview of where these resources have been allocated or categorized. It's important to note that only 25 million or approximately 25 million has been required to reimburse direct cost incurred by the state. That reflects some of the state's earlier investments in virtual adaptations paying off, as well as our ability to be lean and efficient in this time of crisis. Going through these next two slides, we'll focus on our economic, community, and individual relief programs, and I'll go through each one of these in priority. I won't go into too much detail on the trust fund. I know Commissioner Ely will have a few more notes on that later in the presentation, but we'll note that helped prevent a 300% tax increase on our unemployment and premiums for employers. The next major priority, and the first priority that was established by the FSAG group for direct relief to Tennesseans, was the TBRP Business Relief Program, or the Tennessee Business Relief Program, administered by the Tennessee Department of Revenue. That supported the receipt of direct grants by over 27,000 businesses. It relied on the tax system for a streamlined distribution process, and leverage for us was limited in some respects by the guidance that we had, which required us to, through Department of Revenue. Of course, as members of the committee are aware, not all businesses and job creators have reportable sales tax through the sales tax system, which is why we established the Surge Business Relief Program as a follow-up to the Tennessee Business Relief Program. Under the guidance, we are required to have that established individualized analysis for each recipient. The Surge Business Relief Program allows those businesses who were not captured in our sales tax system to be able to apply, make application, and demonstrate through bank records or other financial statements that they had incurred loss as a result of the COVID-19 pandemic and corresponding economic downturn. Across those two programs, we're projecting over $300 million in relief, and to date have paid over nearly $240 million of that. The Tennessee Community Cares Program was another program established to support many of our worthy Tennessee organizations, specifically 501c3 nonprofits. One of the things that we observed under the broad Coronavirus Relief Fund guidance was that activities taken by a nonprofit to benefit other Tennesseans, for instance, the packaging of meals for individuals who are experiencing hunger or job displacement due to COVID-19, or the establishment of additional school supports for school students who may not be in person, who require those individual supports. Those types of activities, one, were much more necessary in the immediate response to the pandemic, but two, were also eligible for reimbursement under the Coronavirus Relief Fund. What was required in order to get those funds to the nonprofits was a program and a process by which those expenses were validated and eventually reimbursed. So we worked with our partners at the Department of Human Services to stand up the Tennessee Community Cares Program, which engaged directly with 6 grant administrators across the state to provide a regional approach to work with those nonprofit agencies in those areas and help distribute those funds in an orderly and judicious fashion. Understanding that in many cases, federal participation in a federal grant is not a core expertise for a lot of nonprofit agencies. Their core expertise is in serving Tennesseans. So by working with those grant administrators who may have more experience and our DHS professionals, we're able to help them to walk through that process, which in many ways can sometimes be very daunting and intimidating.
Mr. Nick Najad, I just want to, of course, I really appreciate this, but I would ask if at any of these line items, if the member of the body wanted to have some additional $113 million were distributed among those folks, correct?
Yes, sir. And that's one of the things, and that we were required to do that for
Right.
United States Treasury. And that was one of the reasons, that was one of our developing that system was our first course of action in administering these funds. And we were very excited to roll out a system that we call the Tennessee CAM system, the Tennessee CARES Act Management System, that centralizes this data and manages and gives us insight into workflow from the time that a reimbursement request is requested to a time that it's paid, and the multiple states of review in between. We were able to procure a vendor, the Horn Group, which was able to, a business analyst group, which was able to help us develop and build that system. Mm-hmm. And we're very pleased and have learned a lot of great lessons in the development of that system, that grants management system, over a short period of time. It feeds into the dashboard, which allows members of the committee to click through to see if you wanted to know how many agencies in Putnam County participated in this, you would be able to find that information. And while we endeavor to keep that up to date, we're always happy to provide more up to date if for some reason the dashboard falls out of date.
I don't want to interrupt you too much because I know we have some members who are already on the list for questions. So I thought maybe if we could try to scurry through the remainder. The next slide, 16, looks pretty self-explanatory like you did the other, but I noticed that you've also got some CARES Act 2 stuff on there too. So
Why don't you speed
Yeah.
through these next 2 slides
Okay.
quickly, and then we'll take your questions.
Absolutely.
Yes.
Absolutely. So,
Thank you.
So I won't run through these in individual fashion, but slide 16 here, K through 12 higher education, emergency broadband, ag and forestry, tourism, and workforce development, all various initiatives to work with those agencies in the parentheses to support the purposes described in the box all the way to the right. Also tracking administration, that's going to result in some savings to that number. That is the number as of December 30th, projected $200 million to support our state and local cost share. Typically with FEMA Public Relief, there's a 25% cost share. The Biden administration on January 21st announced that 25% cost share would be waived retroactively, which means that for purposes of managing this coronavirus relief fund grant, this $2.3 billion, we will de-obligate those funds from the team of response since they're no longer necessary and allocate them to other strategic uses.
So again, those original dollars that we put in from the state would have or could have been used for that purpose, but now that the federal government did what they did, then we'll get those dollars back to be able to continue to expend under CRF.
Yeah, and speaks to some of the challenge and complexity with various federal grants coming in all at once, and sometimes what may feel like a lack of coordination, or not a lack of coordination, but perhaps duplicative effort at the federal level across more than one agency, Treasury giving us funds for this purpose. We will also give you funds for the same purpose. CARES 2, also known as the Coronavirus Relief and Response Supplemental Appropriations Act of 2021, was passed in December. We are at various points in the process of processing those actual individual grant awards. Some are farther along than others. They do depend on federal agency action in order to make its way down to the state, which includes the agreements, the certification, but primarily for our purposes, the eligibility and limitations on use of. You'll notice a pretty impactful figure here in ESSER 2, which was nearly $1 billion, $996 million that went directly to LEAs. That's on top of that $260 million number cited earlier. So already, even before this package that's being considered by Congress right now, over $1 billion in new federal funds have flowed through directly to Tennessee public schools. The healthcare funding provides additional relief on top of that FEMA relief, which I described earlier, $61 million for vaccine support and $393 additional million for testing and tracing. And then currently underway is with the Tennessee Housing Development Agency is a emergency rental assistance program that was approximately $380 million that made its way to Tennessee and is available to applicants who are experiencing challenges in making their rent payments due to COVID-19. We're tracking these funds closely and working closely with agency leaders to make sure all of these funds are fully implemented. But one of the other benefits of these non-coronavirus relief, or one of the other features of these grants that are not coronavirus relief fund grants, is they typically have much longer grant periods of performance. So for instance, ESSER 2 extends well into next year rather than expiring on December of this year and providing that urgency. Although we are encouraging all recipients to treat this with the urgency it deserves. Just
one thing quickly on the housing THDA. So you'll see there the 456 million. So the way this bill came out, it allowed counties with population, I think it was 200,000.
200,000, yeah.
200,000 to be able to be certified in the remainder of that. The 383 million then will be administered through THDA. So.
And we've coordinated closely. I know you members have heard from Director Perry's office at THDA, but if an individual from Shelby County, back to Shelby County, which chose to administer its own funds rather than having those run through the state. So there's great coordination amongst the local housing agencies and the state housing agency. But we do want to be sensitive to the fact that we do not want to create confusion by having programs. So that's why the state program does not overlap with these local programs. So that's
DHS, or if you already
Child Care Development Block Grant Fund. That's an expansion of an existing program the state has always administered that supports our child care agencies and is the fund that's being leveraged for pandemic child care assistance.
So, Mr. Chairman, let's pause there. I want to talk a little bit more as we finish about kind of what's next. But I think now would be a good time to pause if you've got questions that you want to go ahead and get
I think we do have a lot of several questions. I will draw note to the members on your dashboard. You have their whole slide presentation for your review if you want. I think the next slide shows a little bit of how well prepared we were for unemployment insurance as it relates to others. I would guess you would call this the periodic table of unemployment insurance, but I thought maybe I was in science class when you sent that over today. But we do have several questions. I appreciate your candor. Obviously, these kinds of revenues from the state or to the states from the federal government have never been seen before in our state's history. And so we really appreciate the diligence in which you and your department and all the teammates, team members across the state have done that. So we do have a few questions. And so I'm going to get to those real quick, and then we'll try to save 4 or 5 minutes at the end for you to update us on the balance. Representative Miller.
Thank you, Mr. Chairman. Commissioner, thank you. I have a question. Actually, it's a committee question. You may have already answered this, but it's my understanding that the CARES Act provided funding for Tennessee Care, utilizing about 6% increase in the amount that we traditionally get. The additional 6% may expire the end of March. Are you concerned about the extension of these funds, and how have we made preparations for the lack of funding?
Yes.
If that were to occur?
That's a great question, and they have done that, and so we anticipate in conversations that we've had with the federal government that they will be extending that through the end of the year. So we already know that that's their intent. The current language, I think, goes through April, right, Tony? But we anticipate that that'll continue through the year end.
The official expiration date per the last extension. So the Family First Coronavirus Response Act established that and established it for the pendency of the HHS declared public health emergency. HHS on January 21st issued a notice to states that it would be extending the public health emergency declaration for 90 days. But in that communication said they intend to extend it for the rest of the year. And at which point they decide to let it expire, they will give states 60 days notice. So we're in a good position to not have that cliff emerge for us.
Yeah, we're in good shape. We should be covered.
Thank you. I had not heard that was going to be extended, or at least that they give you 60 days. That's just a 60-day notice.
I think we'll get to 60 days, but I think there's a real comfort level that this will go through at least year end, and I think it could go in some into the next year.
Thank you, Chairman Garrett.
Thank you, Mr. Chairman. Commissioner, thank you for being here again. A couple of quick questions. Our chairman even mentioned how much federal dollars are coming down here, a little bit unprecedented, about over $2.1 billion coming here under our federal COVID relief program. And of course, our own budget includes $200 million worth of relief. I was curious on how any of this money from the federal government is being tracked by us. Do you have any insight into that? And I've got a couple of follow-ups after that, if possible.
Yeah, hey, you can jump up here, but let me start on that because as I alluded to, we absolutely knew that when we started down this path in April of last year, that for us to get $2.3 billion pushed upon us immediately with an idea that we had to spend it by the end of the year of 2020, that we had a big task ahead of us. And as F&A, I want to make sure that it was done properly, and we tracked every dollar and we understood. As Tony pointed out, every one of those different places that those dollars went came with guidelines and rules and regulations that we had to meet, and they changed multiple times. I mean, like every month they give you a little bit more information, or sometimes take away a little bit of information, and so it was a little bit of a moving target. And so we've been engaged this whole year in making sure that every time something changed, we changed with it, and we were able to track these dollars in order to meet the standard and that has been laid out. And so Eugene in our office Eugene Newbert is the with me, and it's kind of been his second job over this past year to really focus in on this. So expound on that a little bit, Eugene.
Sure. So you may recall one of the things we've done over the last several years is centralizing our accounting offices. So one of the beauties in doing that is back last March, we had two events. We had the tornadoes, and soon thereafter, COVID emerged in Tennessee. Office accounting staff sent out notices to all agency fiscal offices advising them that they needed to start setting up codes in the accounting system in Edison to track those various expenditures, knowing that there would be reimbursements and disaster declarations for the tornadoes, then coming along right behind it with COVID. So our agency fiscal offices have been tracking of all expenditures that they believe to be related to COVID, tracking the funding sources of those, whether they be from a direct federal funding source that Tony mentioned earlier on, or through state funding, that we could then look and analyze as far as whether or not we can go back and reimburse those costs with the coronavirus relief fund dollars. And so we get a weekly report from all agency fiscal offices. I think the report I got last week was week number 40. So that's what we've been doing and tracking those expenditures across all agencies, across all branches. So as Commissioner mentioned earlier in the presentation, we get notices from the legislature's admin office too when they have spending.
It's what I get to do every Friday afternoon.
Lucky you.
Yes, sir.
I'm great to hear. I'm thrilled to hear the way you are tracking this. I'm not really sure how you all would do that. So I'm pleased to hear that. Are you aware, and with this money coming down, are there any restrictions on the funds imposed by the federal government for the cities and the counties that are actually receiving these funds, or what sort of the protocols and what are they supposed to do with these funds as it relates to any of those restrictions?
Well, as you recall, when this came about, we were setting aside dollars for the counties and municipalities to be able to do this. And in last year's budget, we originally had kind of strings attached to that, but we ended up just pushing those dollars on out. We had a fund within this program, within the CRF program, and they have to match the same guidelines and regulations that all the other dollars do. And so it's been an extensive program to your question, to be able to communicate with all of our cities and counties that are able to participate in that program, to be able to make sure that they understood what those dollars could be spent for and not be spent for. And then they were fed up to us. We were able to go through and ensure that each of those dollars are in fact eligible to be able to be covered under that CRF fund. And so any other comments on that?
No, I think you covered it.
Thank you very much, gentlemen. Appreciate
So
y'all being
they
here.
had to meet all the same standard, and have done a good job of being able to report and do that. So, yes.
Thank you very much. Thank you very much, Commissioner.
Thank you. I had a quick question. The legislature approved, just as a follow-up, the legislature approved in FY 20 $75 million in the budget for COVID relief funding. Those are state dollars set aside. In 21, when we came back and did the money again, we did another $75 million for a total of 150. I know that the governor's budget also includes another $150 million for FY 22. So when we look at this, though, based on your discussion about how those federal rules have unencumbered us, I guess you could say, financially less and less over this period of time, that first $75 million that the state set aside, how much of that have we spent? How much of the second $75 million have we spent? And because of this new guidance from the Fed that we're not having to match 25, 75 based upon the reporting, do you feel it's necessary for us to need another $150 million, or are we better off just to take the 150 we had before and keep pushing it?
Yeah, that's a great question, Chairman, and one that we've debated a lot internally. So the good news is we hadn't spent any of those dollars because of the changes that we were able to do to get the federal government to cover those expenses. We've been able to avoid spending those dollars from fiscal year 20, fiscal year 21 as well. We still felt like going into this year in the budget process, as we looked at the 22 budget, that even though we hadn't had to spend those dollars, when you think about the size of these dollars that have been expended, and making sure from a vaccination standpoint, from a testing standpoint still, even though that's now minimized more than the vaccination, that we had the state dollars available to do what needed to be done. If any county or city or whatever needed to be, we needed to respond. And so that's the reason we went ahead and put the additional $150 million in this year's budget, recognizing that if we get through this year and the vaccination goes well and everything goes as expected, then we'll be able to revert some of those dollars back in next year's budget and have those dollars to spend on other things. But it seemed to be the prudent thing to do to make sure that we were prepared. We spent a lot of time trying to be prepared to make sure we were able to withstand whatever came our way.
I get it. I appreciate the work that you guys have done. I think, when you look at $300 million based upon how much money they sent us, is still only 12-13% of the total number they've said. So even if we were trying to match it at 25%, we're still woefully short. I get that. I think the guidance also changes your mind a little bit about, how much do we really need to set aside. But I appreciate you answering that question. I do have a question here also from Chairman Hicks. Chairman Hicks.
Thank you, Mr. Chairman. Commissioner, certainly
I know,
good.
I know where you are now.
Good to see you. I think your day has been almost as long as mine. So just a quick question regarding the report. There's a discrepancy that it seems to be a discrepancy on page 7. The report states HHS supplied 5,811 Tennessee hospitals a portion of the $738.8 million appropriation, yet the Department of Health only has 150 hospitals. And then we see that again on page 8. It references 7,440.
I think our pages are different, but that.
So
Yeah.
that's I appreciate the catch there, Chairman Hicks, and I see the discrepancy there. That should say 5,811 Tennessee providers. It says hospitals. That's an error in the report, and we'll get that corrected. All CMS registered providers receive the payment. That's physicians, hospice groups, primary care doctors. I think hospitals there was just a drafting error.
And then kind of just a final question, as far as the funding that's being accounted for in the Department of Health, what's the accountability there? What measures are being taken?
So
I think there's, I may take this,
Okay.
Chairman, actually. Mr. Chairman, if you could repeat that question, I'm trying to understand what funds you're making reference to.
So the discrepancy, explain how this funding is being accounted for in the Department of Health, just the funding for all the providers, as you've stated.
Yes, sir. And so, and that's part of the challenge that we're experiencing. So those funds don't actually flow through the Department of Health. The HHS Provider Relief Fund, we track it and report on it because we think it's important to know for planning purposes and transparency purposes. But that actually goes directly from Department of Health and Human Services to those providers, including hospitals. And so the way it works is those providers get a notice, they get a link to a portal, they upload their information, and that administration and oversight is all handled at the federal level we don't have any direct role in overseeing those funds, but we do report on them because we think it's important to know and understand the scale of federal relief going out there.
Okay, thank you very much. Thank you, Chairman. Thank you, Commissioner.
Let me just add on to that. So that's been that's been an important point throughout this, is recognizing that the FSAG group that we've been involved with over the last year is really been focused on that 2.3 billion, but we've got several billion more dollars that have been coming in that have been going directly to either providers or Tony mentioned the amount going to the LEAs that have been outside of us. And so it is still important for us to try to make sure those funds are spent wisely, even though they're not directly accounted for by us. So.
Thank you. Several years ago, I guess it was 3 years ago, the legislature passed a Rural Hospitalization Stabilization Act. It was 3 years of $1 million funding where we, through ECD, rural hospitals could apply for grants in order to make sure that rural hospitals stayed open across the state. When we issued these dollars, obviously, CARES Act funding for these hospitals, as Chairman Hicks related to, was there anything in CARES Act funding which was designated strictly for rural hospitals to help them? Obviously, if we're just spending money by sending it to providers or we're sending it to individual institutions, that's one thing. But rural hospitals we're already struggling, obviously, which is why we had the Stabilization Act over the years. Did CARES Act funding do anything in order to help those rural hospitals thrive during this period of time? And if so, what was that?
Yes, sir. And in fact, we're in the process of drafting a report on this, similar to the paragraph that Chairman Hicks flagged. That is reported on by HHS, not administered by us, but we are tracking that. HHS and the Provider Relief Fund administered close to $175 billion authorized by CARES for the national healthcare industry. They distribute that in multiple tranches, and I'll have to, for the final and most clear, precise answer, I'll have to give you the written report, which is in progress. But I'll tell you right now, I know there was a general provider tranche of funds distributed. There was a high impact provider tranche of funds that was distributed for hospitals who had 100 or more COVID inpatients. And then there was a rural provider fund administered. And so unfortunately, right now, part of the challenge is HHS has reported those, despite them all being under the umbrella of provider relief, has reported those separately. So we're in the process of merging those because a hospital could sometimes qualify for more than one tranche of funds. So we'll have that report. We'll share it with members of the General Assembly as soon as we have it and updated on the FSAG website. But we do know totals for and could cross-reference that. That's also in addition to the Small and Rural Hospital Grant Program that was launched in April. That was launched in direct response prior to the CARES Act distribution and due to concerns of illiquidity for some of our small and rural hospitals. And so those funds were distributed in tandem as in some respects, the provider relief funds were slow to get out there. Ultimately, that $10 million, while it had an impact for a few hospitals, it was absolutely dwarfed by the HHS funds, which came down soon thereafter.
Thank you. I just, on page 16 and continued on 17, it talks a little bit about those. It looks like, based upon the Financial Accountability Report, that those 29 rural hospitals that did receive funding for those, the state may be able to get those monies back or have the federal dollars applied towards those. So we might just check into that. I noticed that was on that page.
Yes, sir. I think we can certainly look into that. I think what we did throughout that grant process is we made sure that those were balanced against the provider relief funds or what those hospitals were eligible for. But if we do find an overpayment, we'll certainly address that as part of the monitoring process.
Thank you. Chairman Faison.
Thank you, Mr. Chairman, Commissioner. It's good to see you today. For years, my community, we're 40% of the people I speak for don't have access to internet. And when the governor said he was putting 200 million, I immediately was excited. And I've done some research. We put 62 million not too long ago. Federal government's put 61 million. Now we're fixing to put 200 million. So just a few questions. That's an incredible amount of money. In my 10 years, everybody says, "Oh, you just give us the ability to compete against AT&T or Charter, and we're going to spread it out there." At the end of the day, for my people, they go to the same block that AT&T and broadband is, and nobody cares about the 40% that are deep into the woods. Me personally, I don't have high speed because I live so far out in the country, which I'm not complaining. I'm thankful so that I live out that far. But my question for you is, how are we going to regulate this? Is this just going to be everybody who can just willy-nilly come and grab money? And at the end of the day, are we going to be able to show we invested well, from the state 260 million, and this is what we have to show for it?
Yeah.
Can you kind of walk me through that?
Yes, sir. I'll take a stab at it, and I'll also say that I don't know if have y'all heard from ECD yet? I don't know if ECD's been before the committee yet, but that's it's also a question for ECD because they are at the tip of the spear in developing the program to be able to do this. Let me address the main question, and that is when the governor was talking about this budget, we met with ECD numerous times and said his goal was how do we cover every community in Tennessee, and recognizing, to your point, is that you've got to get beyond the low-hanging fruit to be able to do that. And so in looking at that, recognizing that there's always a moving target because more people are moving in and there's more rural areas that people are moving into, maybe you never get there, but that should be our aim, is to get to every Tennessean in this process. And the 261 million that you point out doesn't even account for what we've done over the last 5 years or 6 years, because this was started under Governor Haslam before Governor Lee came into office. And so he recognized, though, that 10 million, 15 million at a time toward this effort was never going to get the job done. And so that's the reason he went big this year to try to step into this void and say, let's do what it takes to try to cover every Tennessean. So the answer, so that's the intent. I know I can address the intent. The process that we'll use, it will be similar to what ECD has done in previous years, where they put out proposals and let the private sector and the utilities come in and put their proposals as to how many people they would cover for this many dollars. And the way we have typically done that is we've done that kind of 50-50, where the state has subsidized those proposals roughly 50%. In this case, we recognize that to get to the audience, to get to the people that we really need to get to, we may have to do more than 50%. We may have to look at different technology than the exact same way that they've been doing this over the last few years. And so I don't know if you have anything to add to that, Tony, but the answer to it is we're going to approach it differently. They are going to approach it differently, and I would urge you to continue to talk to them about that, because they've got a plan. They've got a good plan as to how they intend to do this that I think will get us toward where we need to go.
No, I wouldn't add anything to that. I think you'll be very pleased with ECD's strategy here that works backwards off of just some very clearly defined metrics of who is unserved out there, and also incorporates into it some strategies for getting better data on who is unserved. Currently, we rely on FCC data, has gaps, has lags to it. Part of the process that will be implemented very quickly here will be our own Tennessee census block level maps, which will give us much more reliable insights into where these grants need to go to serve our Tennessee communities.
Chairman Faith.
Thank you, Mr. Chair. That was my thing, just to make sure, because there's been so much talk over the last 10 years. I just want to make sure that your office, before y'all put the green light, they're not just going to the last block that the last
Yeah.
guy went to.
Yeah.
And I mean, I'd love it if you came to my house, but just make sure we get people deep in the country have something. So one final question though, is how much of the original 61 million is left? Has it already been spent?
No,
Do we have any?
Yeah, that was very successful.
Okay.
I think of the 61, we've already got 56, 58
Yeah,
million
yes, sir.
in the ground.
There's close to 4 million out there still being validated, but it was a tremendous learning experience to see how quickly through that engagement with the provider community, how quickly they could identify those last mile projects when we told them, you have to have this done by December 30th or you're not getting paid effectively. And so it's been very successful. There were less than 3 projects that needed to extend or take advantage of that congressionally extended deadline. And those are still in process of validation right now.
Thank you, Mr. Chairman. A quick question. Commissioner, on this third round of CARE Act dollars now being discussed in Congress, assuming that Congress will support the Senate reconciliation or whatever, if you are following that, what do you anticipate coming into Tennessee?
Yeah. I'm gonna let Tony and his team have been following that on a federal basis. Once we figure out what we're going to get, I'll make sure it's accounted for. But that's a great question, and it's still somewhat up in the air. But I think we have some feel for what that would look like.
Yes, sir. And Representative Miller, the challenge, part of the difference of this package that is a departure from previous formulas before is that the House considered and the Senate accepted a formula that was majority unemployment based. So there are 2 formulas for state and local aid. A very small pot of approximately $25 billion is to go to states on a per capita, states and District of Columbia on a per capita basis. The remainder, close to $200 billion, goes on the basis of a state's share of the national unemployment figures. So because Congress has not calculated out what those look like, we don't know what the exact distributions are. We know that on a very unofficial basis, if we trust our math, we're looking at approximately $3 billion to the state of Tennessee. Billion.
Yeah, with a B.
With a B.
Representative Shaw.
Thank you, Mr. Chairman. And just to follow up, which is a little more than what we got the last time. Is that fair to say? Because I think what it was 2.3 billion last time.
Yes, sir. So the 2.3 billion was part of the coronavirus relief fund that we've been focused on here.
Okay.
The 3 billion that we're talking about will not necessarily come in that same way. It likely will be dictated or allocated directly to a lot of the providers and a lot of the entities, similarly to where these dollars were.
I think from our perspective as a state, thinking just about that state and local aid as well as the local aid, for us, it's the amounts are significant and important, but it really does come down to what can those funds be used for? Because one of the biggest challenges with the coronavirus relief fund in getting those to where it needs to go was the federal guidance that was often changing, the limitations that were in fact a challenge for a lot of beneficiaries to follow along with. So we're very we're waiting to see what the strings attached to those funds will look like.
One final question. On page 15 of the report, it describes an increase in expense for emergency medical service. Ambulance assistance program, I think about $867,000. To that was to be reimbursed through an expense related to an installation for disinfecting UV light systems. With the increase in funding, how does this affect the ambulance service assistant? And will we have the increase in state expenditures for what we have already budgeted for to maintain our state match?
So as I understand it, sir, so you're asking about the EMS ambulance assistance
Yes.
program.
Uh-huh.
That was funded by the Coronavirus Relief Fund without any requirement of match by the recipients. And those were funds that we received by virtue of being the state of Tennessee without a match through the Coronavirus Relief
So
Fund.
there will not be a match, you're saying?
So it does, as I understand that program, sir, it does not require a match. It just requires the
Okay.
ambulances.
Oh, I got
to-
you. Okay.
Eugene, am I right here?
Yeah.
I think we.
They've
this
got to
is
use
the
it for
Department of
that.
Health program.
They've got to use it for the
For that
intended purpose,
purpose,
but
yeah.
it's funded 100% with Coronavirus Relief Fund dollars.
Okay. Thank you.
Yes, sir.
Thank you so much.
Thank you, sir.
Commissioner, I told you I'd give you a few minutes to land the plane at the end, and we are past the runway, but I
Okay,
thought
well,
I'd go ahead and
all
let
right,
you talk.
I'll keep this short. So I want to go back to your periodic chart. And I hadn't thought about it that way, but you're exactly right. So I'll just point out the obvious is that Tennessee has been fortunate to be in the position that we are in because we have been much more prepared and are one of only 6 states where there is unemployment insurance trust fund balance of over $1 billion. And so that's something that I think we can all be proud of. And it's something that not only helps every Tennessee business, but it helps everybody in Tennessee who is employed by a Tennessee business. Kind of closing out the original coronavirus relief fund, the $2.3 billion. Even though we've got till the end of this year to do that, our intention is to go ahead and do that by June 30 on the fiscal year, and so that's what we're shooting for. Secondly, as mentioned, all the funds that we're talking about flowing through, our intention is to continue to come back to you with the expansions, to the finance committees with those budget expansion requests, and so you'll continue to be seeing those as we go through the year. And then third, certainly we're going to be watching for what comes out of Congress. We know there is going to be something, and we know that we got to be prepared to do that, and we've got a good system in place to continue to do that. And so we'll be watching for that. And then finally, our FSAG group that I would welcome all of you to participate in listening into those meetings or participating in those meetings. We'll be continuing to do that every month or so over this year, and making sure that we're keeping abreast of those future dollars that come in. And so we appreciate what you're doing as a committee, and look forward to continuing to work for you. And any questions that you have, please let us know. We'll continue to work with you in any way we can. Thank you.
Thank you. I appreciate you coming today. I know there were a couple other questions we didn't get to. We'll just email those to you, staff. Hopefully you can get the answers back to us in a timely fashion. I guess the only closing question I had for you is, as long as there's monies coming from the federal government, my expectation is the FSAG will continue to operate, or I mean,
Yes, sir. I think so. It's been very successful. It's been a great collaborative experience between it's a bipartisan group. It's members of the House, members of the Senate, speakers, and the governor. And so I think we'll continue to look at that, but we'll see how much leeway, because a lot of the purpose of that group was continue to be sure that that we had input and advisory from that group. This next bill may not give much leeway to the state as to how it expends those dollars. And so, but the intent now is that we certainly will continue to use that group to get input and advisory and how those dollars are spent.
All right. Well, thank you for
Yeah.
your testimony here today. We're going to go back in session. Is there any other business before the committee before we adjourn? Seeing none, you are adjourned.
Thank y'all.
Thank you.
Specific